Prostatitis is one of the most frustrating, painful, and confusing conditions that many men face, and sadly, it often goes misunderstood or misdiagnosed. If you're watching this video, chances are you've been dealing with persistent pelvic pain, discomfort while urinating, difficulty in sexual performance, or even a sense of chronic fatigue and mental stress related to this condition. The good news is, prostatitis can be treated, and in many cases, cured permanently. But to get there, you have to understand the full picture: what causes it, why traditional treatments sometimes fail, and how to take a whole-body approach to healing. The prostate is a small walnut-sized gland located just below the bladder. It plays an essential role in the male reproductive system by producing fluid that nourishes and transports sperm. When this gland becomes inflamed, infected, or irritated, it leads to a group of symptoms collectively called prostatitis. Most men associate it with pain, whether it's in the lower abdomen, the groin, the perineum, or even during urination and ejaculation. But prostatitis isn't just about physical discomfort. It also brings emotional strain, anxiety, and in many cases, a deep sense of hopelessness, especially when symptoms persist despite medical treatment. To find a permanent cure, the first thing to understand is that prostatitis is not a one-size-fits-all condition. It's actually categorized into 4 types. Acute bacterial prostatitis is the least common but most obvious. It comes on suddenly with fever, chills, and severe pain, usually treated successfully with antibiotics. Chronic bacterial prostatitis is more subtle, often recurring over months or years, but the most common form by far is chronic prostatitis or chronic pelvic pain syndrome, which has no obvious infection and is often linked to muscle tension, nerve irritation, and even emotional stress. Then there's asymptomatic inflammatory prostatitis, where inflammation is present, but the man feels no symptoms at all. Because these forms vary so much, the treatment that works for one man may not work for another, and that's where the frustration begins. Many men are given even when no bacteria are found, and when the drugs don't work, they're often told, "There's nothing more we can do." But this approach misses a critical truth. Chronic prostatitis is not always a bacterial issue. In fact, studies suggest that less than 10% of cases involve actual infection. The rest are rooted in dysfunction of the pelvic floor muscles, the nerves, the immune system, and the emotional state. That's why the only path to a permanent cure involves a deeper look into your body and lifestyle. It's not about suppressing symptoms for a week. It's about healing the system holistically. Start with the most overlooked cause: tension in the pelvic floor. The muscles that surround the prostate, bladder, anus, and base of the penis can become chronically tight due to poor posture, anxiety, prolonged sitting, or traumatic injury. Over time, this tension creates a feedback loop. The tighter the muscles get, the more irritated the nerves become, and the more irritated the nerves are, the more sensitive the area feels. Eventually, it becomes difficult to tell what's physical and what's neurological. This is why physical therapy focused on pelvic floor relaxation is so effective for so many men. When those muscles learn to let go, blood flow improves, nerve pressure decreases, and healing can begin naturally. In addition to physical therapy, posture correction is another critical piece of the puzzle. Most of us spend far too much time sitting, whether it's working at a desk, driving, or lounging on the couch. Unfortunately, sitting puts pressure on the perineum and pelvic muscles, aggravating an already inflamed prostate. Poor posture, especially slouching or leaning forward, only makes it worse. Making a conscious effort to improve your posture by standing more often, walking daily, doing hip stretches, and strengthening your core can reduce strain on the pelvic area and restore natural muscle balance. It may sound simple, but for many men, posture correction is a breakthrough moment in their recovery. Now let's talk about diet. What you eat either fuels inflammation or helps reduce it. Many men with prostatitis notice that their symptoms flare after consuming alcohol, caffeine, spicy foods, or processed sugar. These substances irritate the bladder and prostate, and if your system is already inflamed, they can make things worse fast. By shifting to a diet rich in anti-inflammatory foods like leafy greens, berries, omega-3 rich fish, nuts, seeds, and whole grains, you create an internal environment that supports healing. Hydration also matters. Drinking plenty of clean, filtered water helps flush out toxins and reduces the concentration of irritants in your urine. On the other hand, holding urine for too long or becoming dehydrated can increase discomfort. Some men also find that food sensitivities contribute to their symptoms, especially if they have digestive issues alongside prostatitis. In some cases, gluten, dairy, or high oxalate foods may aggravate inflammation. If you suspect a link, working with a nutritionist or trying an elimination diet might provide clarity. It's not about following trends, it's about learning how your unique body reacts. We also need to talk about the role of stress. Chronic stress is one of the most overlooked but most powerful drivers of prostatitis symptoms. When your body is in a state of constant tension physically or emotionally, your nervous system stays in fight or flight mode. This state contracts muscles, including those in your pelvis. It tightens blood vessels, reduces oxygenation, and increases pain. Sensitivity, that's why even if no infection is present, stress can make the symptoms feel worse. In fact, some men find their symptoms begin or worsen after a traumatic event, relationship conflict, job pressure, or prolonged anxiety. To heal permanently, you must include mental and emotional care in your treatment plan. Practices like deep breathing, meditation, progressive muscle relaxation, and even guided visualizations can help reset your nervous system. If trauma is involved, therapy may be necessary. Addressing mental health isn't a weakness, it's a powerful act of self-care that directly affects your body's ability to recover. Sexual health also plays a role in prostatitis, though it's often difficult for men to talk about. Men find that too frequent ejaculation causes flare-ups. Others feel worse when they go long periods without sexual release. The prostate is part of the reproductive system, and like any organ, it benefits from healthy regulation. For many men, a balanced approach such as ejaculating 1 to 3 times per week helps maintain fluid flow without overstimulation. However, every man is different, so it's important to observe how your body responds and adjust accordingly. There's no perfect number, only what works for you. Natural supplements may also provide support during healing. While not a substitute for medical care, certain herbs and nutrients can reduce inflammation, support prostate function, and restore balance. Popular options include saw palmetto, which may help shrink the prostate, quercetin, a powerful antioxidant that reduces pelvic pain, zinc, essential for immune and sexual health, and curcumin, the anti-inflammatory compound found in turmeric. Pollen extract from ryegrass, often sold as Sernalton, has shown positive effects in some clinical studies. Probiotics can also be useful, especially after a round of antibiotics, to restore healthy gut flora, which plays a role in overall inflammation and immune regulation. But it's important to understand that no supplement will cure prostatitis. By itself, supplements can only support your efforts. The true cure lies in a lifestyle transformation, correcting imbalances in your movement, stress, diet, and mindset. It's about breaking the cycle of pain and tension and allowing your body to return to its natural state of balance. Some men will wonder, how long will this take? And the honest answer is it depends. If your condition is recent and mild, you might feel significant relief in a few weeks. If it's chronic and deeply embedded, full healing can take several months. But what matters most is consistency. Don't give up after a few days if things don't improve. Your body needs time to unlearn the patterns it has developed. Stay with the program. Track your symptoms. Keep a journal of what helps and what doesn't. Healing is not a straight line, but with each step, you move closer to freedom. There are also cases where more advanced medical intervention is necessary. If you have severe structural issues, recurring infections, or no response to lifestyle changes, a skilled urologist may recommend procedures like prostate massage, trigger point injections, or, in rare cases, surgical interventions like transurethral resection. These are not first-line treatments, but for those with severe conditions, they can provide relief when used wisely and in combination with holistic care. Above all, don't let this condition define you. It's easy to fall into despair, especially when medical answers seem confusing or contradictory. But many men around the world have overcome prostatitis completely. They did it by taking control of their health, making smart changes, and refusing to give up. You are not broken, you are not alone, and your body is capable of healing when you give it the right conditions to do so. So if you're struggling with prostatitis today, know that healing is not only possible, it's within reach. Don't rely on quick fixes or one-size-fits-all treatments. Instead, commit to a comprehensive, whole-body approach that addresses your muscles, nerves, habits, emotions, and beliefs. Be patient, be consistent, and be kind to yourself through